Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning and welcome to the Senior Moment Show. We are happily back here again for another show, and the weather's getting better, and that makes us even happier. My name is Bruce Lee, and my co-host is Sid Roeder. Hello, Sid.
Good morning, Bruce.
It's good to be back with you again this morning.
It is great to have you back.
And we have a special guest with us today. His name is Bradley Holmes. He's the marketing director for Atlas Home Health and Hospice. Welcome, Bradley.
Thanks for having me.
We're glad that you're here. And we're going to have a great show talking about the difference between home health and home care. And so we're going to talk about Comfort Care, my company, a little bit too. So I hope
that means
okay.
I get to ask all the questions, right?
We will let you do that until we have to cut you off.
Oh, there.
But before we do that, why don't we talk about our sponsor, Sid?
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and efforts to provide information to seniors, their family members, and really anybody who cares. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, if you'd like to talk to me personally, you can do so at 435-512-6406.
Thank you, Sid, for sharing that. And I guess at this time, maybe we should just kind of kick it back to you and let you grill us.
Oh, yes. This is wonderful. This is going to be an exciting show because I get to ask all the questions. Well, let's maybe start with you, Bradley. Bradley Holmes with Atlas Home Health and Hospice. Maybe let's start with you as an individual. Why? Tell us a little bit about you, why you do what you do.
That's a good question. I always was going to be an astronaut or a zookeeper, so things changed a lot. It wasn't going to happen this way, but I was in college, and my wife, she's a nurse, so she was doing jobs that would help her get into nursing school, and so she was a CNA at an assisted living up in Rexburg, Idaho, and I needed a job too. Obviously, we were super poor, just getting by, and so I needed a job, and she suggested that I come work there, and that was such a foreign thing to me. You know, growing up with our church group, going to a nursing home was something that I was not ever comfortable with because I just did not know how to communicate there, how to handle those tough situations, and so thinking about becoming a CNA was intimidating, but needing money helps, right? You jump into those hard situations. So I did it, and I fell in love with it really quick, actually. You know, it's a job that helped me to always have a opportunity to take care of someone, and so I changed my major. I went into healthcare administration, graduated in that, and jumped into the assisted living world for a little bit, and that led me to get into home health and hospice, which I've been for the last 3 years. And so yeah, I promote Atlas Home Health and Hospice in the northern Utah area is where I'm at, and it's been great. A lot of good relationships, get to help a lot of people.
Thank you, Bradley. So before we jump into the differences between home health and home care, Bruce, why don't we give our listeners a chance to get to know you better if they haven't listened to us long enough?
Why do I do what I do?
Why do you do what you do?
Besides this radio show, because I get to spend time with you?
Exactly.
You know what? There's some great experiences that come from what I get to do now. I've had opportunities to do different things in my career, and they've been enjoyable, and I've learned a lot. When this opportunity came to do home care, I guess I didn't even really understand at that time what I was really getting into. And then as I got into it, I just felt the depth of it and how much you can do to help people, and realized that for me, that's a pretty important part of my life to be able to serve in that way. And so this particular business that I get to be part of really gives me an outlet to be able to work with families who are often in crisis. They don't know they don't know what to do or where to go or how to get the help that they need as they look at different options, and they need somebody to be able to come in and help them walk that path. And sometimes they become clients of mine, and sometimes they don't become clients of mine. And I'm really okay either way with that. But I really get a lot of joy out of working with people and helping them to put the pieces of the puzzle together so that they can live a better life. And that's what it's really all about for all of us. We want to live our best lives. Our motto at Comfort Care is live your best life possible. And I just believe people ought to be able to do that. And if I can be a person that helps them to do that, helps families to do that, then I really, really enjoy that.
Thank you, Bruce. Well, let's maybe dive a little bit into scenarios that help our listeners to differentiate between what you two do. So if we've talked about this in previous shows before, but if I'm taking care of my aging parent and it's just starting to become overwhelming and I need some assistance, someone to come in and cover certain times a day for me, maybe, who do I call?
Well, let me start by saying with our business, one of the things that I see often is I'll get a call from like a company like Bradley's, a home health and hospice, because you hear the term home health and you hear the term home care, and they're not the same. They're a little bit different, and sometimes they get used interchangeably by even professionals within the industry, because sometimes doctors don't understand exactly what the differences are. Even a social worker doesn't understand exactly what the differences are. Not all of them, but some, just because it sounds confusing. And there are differences between home health and home care. And so that's part of what we wanted to talk about today. So we even have some crossover. So some of the tasks that our company might do might be some of the same tasks that Bradley's company will do. The question becomes, who's going to pay for it? And Bradley is he's going to be able to charge insurance for his services. I'm going to be private pay. And you might wonder, why in the heck would I ever pay for something that I could get my insurance company to pay for it? Well, the reason is because the insurance company doesn't pay for everything. And depending on what you ask for, it might be something that I do that the insurance company won't let him do.
Okay, and maybe we're already coming up on our first break, but maybe, Bradley, I'm going to give you a chance to maybe be a little bit more specific on some of those borderline issues we're talking about.
Yes, and Bruce did a good job explaining that. So a lot of times we do, get a doctor's order that someone needs help at home, and we work with people who are 65 and older, and I'll come back to that, why it's 65 and older, because that has to do with insurance. But there are times where we get there and we realize, okay, we can do a lot of what this person needs, but there are some extra things that they could use that we're gonna refer out and get some more help in here. So I guess when we come back, I can go more into detail of how that works and what we do specifically.
Okay, thank you, Bradley. We're up on our first break. When we come back, if you are interested in also maybe getting contact information for both Comfort Care and Atlas Home Health and Hospice, maybe have your pen ready. This is the Senior Moment Show. We'll take a little break. Stay tuned.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you.
Things have been changing for Mom and Dad lately. It's getting harder to get them the help they need, while also taking care of my own family. I feel like if I help one, I neglect the other. What do I do?
This is Bruce with Comfort Care Home Care, and we understand. Their home is familiar and full of memories. Comfort Care can assist with a wide variety of tasks that help them stay there longer and give you a break. For a few hours a week to 24 hours a day. With Comfort Care, you can live your best life possible. Call me today, 754-7676.
Oh, it seems like yesterday I was playing with my kids on the playground.
Seems like yesterday I was building a treehouse in the backyard.
Time goes by too fast, but there is something you can do to ensure you're taken care of down the road. I'm Tracy Ferris with Quality First Insurance. A long-term care insurance policy is something we all need as we get older. If you wait until you need it, you're too late. Let me help you understand the options and benefits of long-term care insurance. Call me today, 435-752-0101.
Whether you have a small business, large corporation, or sole proprietorship, remember Cook Martin Polson has provided quality accounting services since 1977. At Cook Martin Polson, they believe you've earned it, and they're going to help you keep it. Take a minute right now to call 750-5566. That's 750-5566 to set up your tax appointment and let Cook Martin Polson show you how to keep the money you have earned.
This is Jared Ripplinger with Cook Martin Polson. You've worked hard for your money. Let us help you keep it.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services. When you need us most.
Welcome back to the Senior Moment Show. Today we have the honor to visit with Bruce Lee, who is typically my co-host here at the radio show, and Bradley Holmes. He is the marketing director for Atlas Home Health and Hospice, and Bruce is the owner of Comfort Care here in Logan. So we're talking about the differences between home health care and home care. I had to save that one.
Good job. Yeah.
And Bradley, before we went into the break, we were talking a little bit about those overlap situations, and you touched on the age of 65. Do you want to elaborate on that a little bit more?
Yeah, so everything that I talk about that home health and hospice can provide, it's all a Medicare benefit, meaning that it's 100% covered through a person's Medicare plan. And once someone hits 65 or older, unless they're still working and getting insurance through their company, they will automatically qualify to have Medicare. And so you pay into Medicare your whole life. Now this is a benefit that's 100% covered, these things that I'll talk about. And Bruce brought up a good point. You hear the term home care, you hear the term home health and hospice. Hospice is pretty self-explanatory, but what gets confused is the home health versus home care. So what we typically do with home health is it's very therapy driven, physical therapy driven. So a lot of the people we see, they've just had full knee replacements, they've had shoulder surgery, they've had a fall that led to a broken bone of some sort, and so we come in and help strengthen them up. And what's also provided when that happens is a registered nurse that's there multiple times a week, numerous times throughout the month. Like I said, it's a registered nurse, so trained to do clinical things, because we also do wound care with the elderly, anyone that's up in that upper range. The skin starts to get really thin, so skin tears happen super easily. Scuffs that we have on a daily basis could be detrimental to them, with those skin tears. So we have nurses that are really good at wound care, so that's another thing that home health provides. But then there's other things that, and we have a CNA that can come in and help do showers for people who need help doing that. But the kicker is that with it being paid for through insurance, which is a great thing, which everyone wants to take advantage of, it doesn't last forever. Hospice, which we can talk about even another time, where it's end-of-life care, that's until end of life, so that can go on for as ever long as needed. But home health, we're typically doing it for 2 months. That's when people begin to progress and plateau with therapy. They've gotten strengthened up, and then insurance says, okay, we see that based off of your charting notes and things, it's time for you guys to be done, and in 60 days you can revisit that and see if they need it again, or if they have a fall in the meantime or anything. So now what do? The family has loved having us come in and do the showers and different things, and so a lot of times that's when we'll talk to Comfort Care and say, hey, we have this patient that we've been working with. They'd still like someone to come in the home. And even before that, I think everyone's probably seen a post on Facebook from someone saying, hey, I have a loved one that they need help cooking and cleaning and the things around the house that have become difficult that aren't clinical, right? They're not saying my mom or dad needs physical therapy. No, they need the daily things that you do, that we all do each day. And so those are things that insurance does not consider clinical. So what do? Well, that's what Comfort Care can do as well, is they can come in and be there whenever you need them, the schedule, and do those things. So a lot of times we're working together. We're in there doing the physical therapy, the wound care, we do medication management, we do all those things that, a registered nurse, a physical therapist, these healthcare professionals will go in and do. But they're not going to cook or clean for them. But those are just as important. So Comfort Care comes in and can do that. So we work really well together. It's two great scenarios, great resources to have.
Yeah, I would just add to that in terms of I think you hit on a good point as far as time, because the services of a home health or a hospice typically are of some type of a finite duration. They're usually defined. Insurance companies are pretty specific about the things you can and can't do. So for example, we're not constrained by age. As a home care, we help anybody who calls us. So we fill the gap of what insurance won't cover. And typically our duration with a client or a patient is much longer. We could be with them for years. That's pretty unusual for a home health and hospice to have that type of relationship. It can happen. It usually happens on the hospice side. Home health, it's probably not going to happen. Bradley, you can correct me, but I think those durations are somewhere between 4, 6, maybe 8 weeks or something like that. They can go longer depending on what's going on, but that's typically what it would look like.
Yeah, so 6 to 8 weeks, and then that's when we usually take those, the therapist and the nurse out, and then Medicare has you wait at least 60 days until therapy starts up again, unless a significant change has happened in the meantime. But that's when it's awesome to have home care in there, because
we fill the gap.
You fill the gap and keep us updated. Like, hey, so-and-so, they're doing well, but they did have a fall this week. And when someone starts falling again, that's an automatic qualifier. Insurance will pay for it again. So to be able to have eyes on these, elderly folks that are at home alone is a huge deal. Because a lot of times it's hard. We have to be done, and it's like, oh, I hope they're safe. I hope they're safe now. I hope, we've done everything we can to keep them strong, but, Mother Nature's cruel sometimes. When you're 80 years old, you probably could use therapy every day for the rest of your life, but unfortunately that's not an option. So to have someone with home care to be there to make sure they're still safe is a huge, benefit.
So Bradley, what's the process with home health? Is that typically or always linked with a doctor visit that kind of fills a prescription that then goes to the insurance, or is it ever something that I can do privately?
So we can do it, I guess, to answer that question, it always does require a doctor's order. And so a doctor's either initiating it because they came in for a 6-month checkup and he or she is thinking, hey, they could really use physical therapy at home, they're getting pretty weak. Or if it's someone that their mom needs it, they can reach out to us, and then that's what my job is. I go to that patient's doctor and say, hey, their so-and-so's daughter reached out to us. They would like a nurse to be coming in for the next couple months, physical therapist, and then I go to I have the doctor sign those orders. So yeah, everything is by doctor's order. The way we get that is either by them initiating that or myself going and asking for that order.
Thank you, Bradley. Sadly, we're already on our second break here, but we're going to come back after this break, and this time we're not going to forget to get your contact information. This is the Senior Moments Show. We'll take a little break. Stay tuned.
If you're retired or plan to retire soon, will you outlive your money or will your money outlive you? If you don't know the answer, I can help. Hi, I'm Patty Bartholomew, a financial consultant with Parsonex Securities. If you have questions about your financial plan or just need a second opinion, call me today at 435-227-5556.
Investments are not FDIC insured, nor are they deposits of or guaranteed by a bank or any other entity, so they may lose value. Investors should carefully consider the investment objectives, risks, charges, and expenses of the funds. This and other important information is contained in each fund's prospectus and summary prospectus, which can be obtained from a financial professional and should be read carefully before investing. Securities offered through Parsonex Securities, Inc., member FINRA, SIPC, 8310 South Valley Highway, Suite 110, Inglewood, Colorado, 80112-303-662-8700.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty. I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
When it comes to successful aging, eating well matters. Staying physically active matters. Getting socially engaged matters. Living alone, aging alone, it's harder to consistently do that. Hi, this is Chris Grohl with Pioneer Valley Lodge, where we make it easier to do those things every day. Our mission at Pioneer Valley Lodge in North Logan is to help seniors live better, age more gracefully, and stay independent for as long as possible. Pioneer Valley Lodge, an independent living community for seniors.
Welcome back. This is the Senior Moments Show, visiting today with Bradley Holmes with Atlas Home Health, let me say that right, and Hospice, and Bruce Lee from Comfort Care, and also my co-host here. When we went into the break, we promised that we would get both of your digits out there in case somebody has a question for you. So maybe, Bradley, let's start with you.
Yep, anyone can call my cell phone. It's 435-730-8380.
And Bruce?
Yeah, they can call our office at any time. Our number is 24/7, and so regardless of when you think you want to talk to somebody, you can call, and they'll get us a message if it's after hours. But the number is 435-754-7676, and our office is just in North Logan.
Great, thank you, Bruce. Let's talk a little bit about home care, because the variety of services in home care, Bruce, is a little wider that some people don't imagine all the things you can do. We've talked about that you can come in and do light household chores. There could be some cooking. What other things do you provide?
You know, that's the question I always get when I first sit down with a family. What are the things we can do? And there are many things we can do, other than the things that the home health does that we can't do, such as medical related stuff like the wound care or needles or IVs or catheters. Those are things that we don't do. Where we cross over is with things like bathing and dressing and showering. Those are some things that people tend to think are medical, and they're not necessarily medical. We can even do prescription medications that are non-narcotic. That's a recent change to the law in the last year. We couldn't do that before. So we do med reminders, but we can actually help people with getting their meds. And then after that, it really is almost like a personal assistant, where we're not constrained by an insurance company saying what we can and can't do. It could look like anything from we need to do the bathing and dressing to some cooking and cleaning, dusting. It could be I want to go for a ride to Bear Lake and get an ice cream. It could be we want to go over to Crystal Hot Springs and sit in this. I mean, we've had all kinds of things. We've even had people call us for one-off stuff like we need to go to Provo to have a medical procedure and we want you to take us down there and bring us back. Or we've had people call us for an outpatient procedure where they don't have family here, but they need somebody to be with them for 24 hours. And so they call us, and we're there, and that's the only thing we do. We're just there with them for the 24 hours, and that's it. And so our service is very customizable as we sit down and work with families to try to figure out what they need. But almost, again, like a personal assistant, trying to take care of all the task stuff that a family might have trouble keeping up with to help somebody be in their home and be safe.
So just to be clear, if I'm understanding this correctly, you also provide some overnight services if necessary, or could it be an extended? Because I've had people inquire, because a couple of my daughters have CNA license, if they could come on a trip to Lake Powell with them. Is this something you can do also?
Yeah, we haven't gone to Lake Powell, but we've gone to Bear Lake. We've had people come up for vacations where they've been up to Bear Lake for a week and they've wanted an aide to be up there with them, and so we've done that. Really pretty customizable in the things that we can accomplish. And so if people have a unique situation, I would say we just would sit down with them and try to figure that out. Obviously, that's not something an insurance company is going to do, right? But that's, again, that falls into the gap where, look, we need help. Someone has to do this, but nobody's going to pay for it. So it's going to be a private pay solution. So that's what we do.
So Bradley, in your case, there is, I assume, an initial meeting with the client, and then you set times and structures to achieve that. Can you maybe give us a specific case of something, without names obviously, of some of the things you do?
Once a doctor feels that their patient could benefit from having home health go on in their home, the first thing that'll happen is our nurse will reach out to that patient, or if that patient has family members that do the communicating, they'll reach out to them, schedule a time to come, and that's really when the whole plan of care is laid out. So the nurse will dictate, hey, I think given this circumstance, we're going to have a CNA come in for showers X amount of times during the week. Same with how many times the nurse will come in during the week. And then the family has an idea, to figure out what days does that work, what times does that work. And then after that's done, the next day the physical therapist will usually come do the exact same thing, kind of lay out a schedule of when works for the patient or the family, of what days, how many days they'll be coming in, and then same with the occupational therapist. And we do speech therapy as well. So just as many things and therapists they need, they will all come in individually. And meet with the family and talk about when would work for them and what exactly they'll be doing, so that there's no questions there.
That is great. We're already on our last minute here of this show, so let's make sure maybe that we do have both of your contact informations again. Visiting with Bradley Holmes, he's the marketing director for Atlas Home Health and Hospice here in Logan. Bradley, what's your contact information?
And it's my cell phone, so it's 435-730-8380.
Thank you, Bradley. And Bruce for Comfort Care.
Yeah, Comfort Care, North Logan, 435-754-7676. And if you call our office, they will just schedule an appointment with me. I actually will come and visit. And that's what we do. And it doesn't cost anything.
Awesome. Thank you both for chatting with me about the differences between home health and home care. I hope we all learned something. Again, the Senior Moments Show is sponsored by the Empowering Seniors Group. If you'd like to learn more about them, you can do so online at empoweringseniors.info. And we'll hope you tune in again next week.